Namaste and good morning to all present here. I Ambika Kaudal from Padmakanya Multiple Campus, Kathmandu, Nepal. I am here in front of you all to present on the topic of utilization of antenatal health and delivery care service in Nepal. Before starting the presentation, I would like to thank the organizer of the program of providing me with the opportunity to share my resource in front of you, all with the help of the platform. My resource is mainly based on the demographic health survey from NDHS 2016. Moving towards the background. The government of Nepal introduced the National Family Planning Program in 1965 years to address the maternal health problem in Nepal. During the 1996 years, maternal mortality was high, about 539 maternal deaths per lakh live birth, and it has been reduced in last 2 decades. Now, maternal mortality ratio (MMR) of Nepal is about 239 maternal deaths per lakh live birth, NDHS 2016. In 2016, roughly 12% of the death among the women of reproductive age was due to the maternal causes. Maternal healthcare utilization is influenced by various factors like age group, education level, ethnicity, occupation, province, and health index, leading to utilization of health services. The overall utilization of maternal care service was still low in Nepal. However, the utilization proportion of antenatal care service was higher compared to delivery care service in health facility. Analyzing the statistics of Nepal and the statistics of other developed country, the situation of Nepal in terms of maternal mortality is still very alarming. Nepal's NDHS statistics are considered to be very effective. Therefore, this research has been done based on this statistics. Appropriate utilization of maternal health care service is very important to reduce the maternal morbidity and mortality. Proper utilization of maternal health care improve the health condition of both mother and child. About 532 in 1990 to 303 in 2015 maternal death occur worldwide as a result of pregnant and pregnancy related complication. Almost all maternal death, 99% occurs in developing countries. According to NDHS 2016, MMR are 239 per lakh live birth, which is still high relative to developed countries. Now, stepping towards the objective of this study, general objectives of this study is to analyze the situation of maternal health care utilization in Nepal. The specific objective of this study were to study the status of maternal health care utilization in Nepal, to analyze the association of different background variables regarding utilization of maternal health care, to study the factors affecting of maternal health care utilization in Nepal. Let's talk about the research method. This research was conducted with the help of secondary data of NDHS. It is based on the 2016 Nepal Demographic Health Survey. The 2016 NDHS stratified to stage cluster sampling was used in a rural area and 3 stays in urban area to select household for the survey. The NDHS 2016 sample contained 11,473 households and 12,862 women aged 15 to 49 years was interviewed. Response rate was 98%. The study population was 3,966 female respondents. 6 questionnaires were administered in the 2016 NDHS. Household questionnaires, women's questionnaires, maths questionnaires, biomarkers questionnaires, field worker questionnaires, and verbal atopy questionnaires. This study has 2 dependent variables. The first dependent variables of the study is ANC visit and second variable is place of delivery. In this study, women's age, women's education, attainment, working status, ethnicity, province, wealth quintile were included in independent variables. Data analysis was conducted by SPSS software. Sample weights were taken in consideration in order to adjust of the sample design. This study adopted 2 levels of statistical analysis. First, descriptive statistics had used to analyze the background characteristics of the study population of women aged 15 to 49 years. Second, selected socioeconomics variables were cross-tabulated with outcomes variable ANC visited and place of delivery. Third, logistic regression was performed to access the association between explanatory variables, socioeconomics variables, and outcome variables. The results are shown in odd ratio. The critical levels was set at 95% confidence interval. After the discussion, the background, the statement of the problem, objectives and methods, now let's discuss the major finding of this research. For the major result, I have made in an index by classifying the age group, occupation, place of residence, province with index, and an output or result. We got the data and information that education status plays an important role. In this research, we got the association with the different background variables on maternal health and also try to view the relationship between the utilization of antenatal health and the delivery of health services. Summary of result, we figured out in this study 25 to 39 is women were in higher number than others. Out of the total respondents, 8.3% were of age 15 to 19 years. In this study, 31.4% of the respondents were illiterate. About 25% respond with SLC and above. The study population, Brahmin and Kshetri and Janajati were equal proportion 28.9%. Newar population was lower 3.7%. Out of the total respondents, 45.9% were work in agriculture and 38.8% were not working women. The higher percentage 24.1 of respondents from province 2 and province 6 has the lowest 6.4% of this study population. About 20% of women were poorest and 16.1% were richest. The highest 72.6% of women aged 15 to 19 receive the ANC services, and the lowest percentage of women aged 45 to 49 received ANC service. More than two-thirds, 78.2% of the women with the secondary level education have received ANC service. About half of the 49.5% women with no education received the ANC service. The largest proportion, 81.5% of Brahmin and Kshetri were received the ANC service. Muslim women 53.6% were received ANC service. Among the total respondents, non-agriculture women 79.4% received the ANC care. The ANC visit ratio was lower in province 6. The province 3 has the highest, 79% received ANC care. The richest woman 88% received ANC care and poorest 56.8% received ANC care. The largest proportion of respondents up to age 30 delivered in the health facility. About 72% 15 to 19 years respondents delivered their birth in the health facilities. Around 50% of women aged 40 to 49 have delivered birth in the health office facility. The adjusted results shows that women aged 30 to 34 and 35 to 39 were significantly more likely to attend at least 4 ANC visits compared with women aged 15 to 19 respectively. Women's education was significant predictor of at least 4 ANC visits. The odds of receiving at least 4 ANC visits were significantly higher among women with SLC and above. Secondary education and primary education compared with women with no education. Disparities in at least 4 ANC visits by women's region of residence. Provincial indicates that women who lived in province 2 and province 6 were more less likely to receive at least 4 ANC visits, and then women who lived in province 1. Women's occupation, women's engagement in agricultural occupation have significantly higher odds of at least 4 ANC visits compared with non-working women. Ethnicity was not significantly associated with ANC visits. It is found that Brahmin and Kshetri women were more likely to receive at least 4 ANC visits, whereas women belong to other caste ethnic group were less likely to receive at least 4 ANC visits than Dalit women. Wealth quintile was a strong predictor of ANC use. Women from richest household, richer middle and poor households were more likely to receive at least 4 ANC visits compared with women poorest household. Thank you for participating in this program and listening to me patiently throughout the presentation. Thank you so much. Namaste.